Has someone you love started showing subtle but concerning changes over the past year? Many people believe that death in old age happens suddenly, but the truth is, the body often sends quiet warnings months, or sometimes even a year, before life reaches its final stage. The problem is, these signs are easy to overlook because they seem small at first. It's only later, looking back, that families realize the clues were there all along. But by then, it's too late to prepare, too late to make those last memories count. In this video, we'll discuss 5 key signs that often appear a year before an elderly person passes away. Some of them might be things you've noticed, but brushed off as just a part of aging. Others might seem like small changes, but they could actually be signals that the body is gradually declining. Recognizing these signs early gives you the chance to provide better care, cherish meaningful moments, and most importantly, ensure your loved one's final stage of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare both emotionally and practically for what's ahead. When you understand what's happening, you won't be caught off guard. You'll be able to make the most of the time you have left with those you love. Let's get started. 1. Significant weight loss. One of the earliest and most telling signs that someone may be nearing the final year of their life is unintentional weight loss. At first it might seem subtle, a belt that suddenly needs tightening, clothes that feel looser, or a decrease in appetite. Many families dismiss it as just part of getting older, but weight loss without trying is rarely a good sign. It can indicate that the body is no longer absorbing nutrients properly, muscle mass is decreasing, and essential systems are slowing down. While aging can lead to some muscle loss, when it happens too quickly, it's a sign that something deeper is going on. The body may be struggling to digest food properly. Cognitive decline can reduce appetite, leading to a downward spiral where the body doesn't get enough fuel to sustain itself. If you notice significant weight loss, especially if your loved one is eating less, feeling weaker, or struggling to stay active, it's important to take it seriously. This isn't just about physical appearance, it's the body sending a message. Understanding that message now can help you prepare for what's ahead with clarity, compassion, and the ability to make every moment count. 2. Extreme fatigue and weakness. Another noticeable change that happens in the year leading up to the end of life is deep, persistent fatigue that doesn't go away with rest. This isn't just feeling a little tired after a long day. It's a profound exhaustion that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge. Walking across the room requires effort. Even activities that once felt routine, like cooking, dressing, or holding a conversation, start to drain them. This isn't just a normal part of aging, it's a sign that the body is conserving its remaining energy. As organ function slows down, the body prioritizes what's essential. The heart doesn't pump as efficiently, circulation weakens, and muscles don't get as much oxygen as they once did. Metabolism also slows down during this time. Instead of fueling movement, the body shifts its energy toward preservation. This is why someone in their final months may need more naps during the day and find it harder to stay awake for long periods. Some may even experience sudden drops in energy. One moment they seem fine, and the next, they're completely drained. The emotional impact of fatigue is often just as heartbreaking. Many seniors who once took pride in their independence may feel frustrated or even embarrassed that they can't do what they used to. They might withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they don't care, but because they simply don't have the energy. This can lead to a cycle of isolation that accelerates the decline. If you notice a loved one experiencing ongoing fatigue that doesn't improve with rest, take it as a sign that their body is going through a major transition. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. Cherish conversations, create moments of peace, and support them without expectations, because in the end, what matters most isn't how much they can do, it's that they feel loved, understood, and at ease. If you're still watching this and finding these insights helpful, please comment number 2 below to let me know you're here, and if you haven't subscribed yet, I recommend you do so and turn on the notification bell so you don't miss any videos. Your support helps us keep creating valuable content. As a person approaches the final stage of life, one of the most noticeable changes can be in how they interact with their surroundings. Loud environments may feel overwhelming, and eventually, many seniors retreat into their own world. You might also notice changes in their mood and behavior. Some individuals become more irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or indifferent to things that once mattered deeply to them. This isn't just a personality shift, it's often a result of the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and the person may stop reacting to situations the way they used to. For family members, this stage can be especially difficult. Watching a loved one lose touch with reality or withdraw emotionally can feel like you're losing them before they're actually gone. But it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are, speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, confused, or less engaged, don't ignore it. These can often be early signs that the body and mind are preparing for the final transition. This is the time to be patient, cherish quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful, because even when words fade, love and comfort can still be felt. 4. Frequent infections and slow healing. As the body begins to wind down, one of the most noticeable physical signs is a weakened immune system. You might notice that someone who rarely got sick now seems to catch every cold, flu, or small infection going around. What used to be minor illnesses may now take much longer to recover from, and even simple wounds like a small cut or bruise may heal more slowly than before. These changes aren't random, they're signs that the body is no longer able to defend and repair itself as it once did. Frequent infections, such as pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections, become more common as the immune system weakens. Many families assume these are just isolated illnesses, but when they start happening frequently, or take longer to clear up, it's often a sign that the body is losing its ability to fight back. Even antibiotics that once worked quickly may seem less effective, and the person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that would have been minor in the past. Another issue that arises is chronic wounds. If small scratches, sores, or bruises aren't healing properly or keep reopening, it could mean that circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and tissues efficiently, which makes healing much slower than usual. Pressure sores, especially for those who are less mobile, can become a serious risk and lead to dangerous infections if not carefully managed. What's even more concerning is that infections in the final stage of life often don't look the way we expect. Instead of a high fever, an elderly person may simply seem more tired than usual, more confused, or less interested in eating. In fact, for seniors, a sudden decline in mental alertness is often the first sign of an infection before any other symptoms appear. Recognizing these changes early can make a significant difference in how much comfort and support they receive in their final stage of life. For families, watching a loved one go through repeated infections can be frustrating and heartbreaking. It's tempting to push for aggressive treatments, hoping that one more round of antibiotics or one more hospital stay will fix the problem, but at a certain point, the focus often shifts from curing to comforting, ensuring they stay hydrated. Keeping their skin clean and moisturized, and minimizing stress on the body can do more for their well-being than another round of medication that may only prolong suffering. If you're still watching this video and finding these insights valuable, please comment number 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you do so and turn on the bell so you don't miss any videos. Your support helps us continue creating valuable content to inform and inspire you. 5. Major changes in breathing or circulation. One of the clearest signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one breathes more slowly or shallowly than before. At times they might pause between breaths, or their breathing may become irregular, speeding up and slowing down unexpectedly. Some people experience a rhythmic breathing pattern called Cheyne-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. These changes often start subtly but become more pronounced and frequent as time goes on. Another common sign is weakened circulation. You may notice that the hands, feet, or even your nose and ears start feeling cold to the touch. The skin may appear pale, bluish, or mottled, especially around the fingers and toes. This happens because the body prioritizes blood flow to vital organs, reducing circulation to the extremities. It's a clear sign that the heart isn't pumping as strongly as it once did. Some individuals may also experience shortness of breath, even with minimal movement. Simply sitting up, speaking, or shifting position might leave them winded. They may breathe through their mouth more often or need to stop and catch their breath while talking. If they once walked across the room easily, but now struggle to do so, their lung function may be declining. Fluid buildup in the lungs can also make breathing more difficult. This can cause a persistent cough, gurgling sounds, or even a feeling of tightness in the chest. Many people assume it's just congestion from a cold, but for elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable and may contribute to a feeling of breathlessness, even when they're resting. As the body prepares for its final stages, you may notice changes in breathing patterns. Some people may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For family members, witnessing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make your loved one more comfortable. Keeping the room cool, using a humidifier, or offering small sips of water can help ease their discomfort. In some cases, medications or oxygen therapy may provide relief. However, the focus often shifts from trying to fix the issue to simply providing comfort. If you notice signs like changes in breathing, cold hands and feet, or a bluish tint to the skin, it's important to pay attention. These are often indicators that the body is conserving energy and circulation is slowing down. This is a time to be present, offer reassurance, and create a peaceful environment where they feel safe and at ease. In these final months or weeks, the most important thing you can give them isn't medical intervention, it's comfort, dignity, and the knowledge that they are not alone. Final thoughts: as we reach the end of this video, take a moment to reflect on what we've discussed: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs often appear in the year leading up to an elderly person's passing. They may not all happen at once, and they may not always be obvious at first. But when you start noticing them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes, the best thing we can do is listen to what their body is telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure that your loved one's final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and letting them know they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you are not alone in this journey. Many families have walked this path before, And while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.